Well, I've got the Director of Public Health here for the Isle of Man, Dr. Henrietta Ewart, and we're just doing a general piece, really. You've been here, I can't believe it, you said to me 4.5 years or something like that. By the time this goes out, it'll be 5. But I don't think we've even talked to you about anything, but I just thought maybe while we're having a chat about other things, to do a general sort of, state of the nation sort of thing.
Yep.
How do we do? Are we better? Are we worse? Over to you as a nation.
In terms of health and well-being, well, this is very interesting because when I came into post, and I initially came as an interim back in mid-March 2015, there were no data here to enable us to know how we were doing.
You're kidding?
No, I am not kidding at all.
So you completely blind on knowing...
Completely and utterly blind.
So you changed that then?
I am changing it. Because obviously you can't just magic data out of the air. You've got to collect it, you've got to analyse it.
Yeah, what sort of data are we talking about? People's health in general?
People's health. We're talking about absolute basics like causes of death. Those, obviously, they're being recorded because you have to have a death certificate when you die.
Sure.
But there was no collation, analysis, interrogation of any of that.
Now in the UK, there's lots of that going on, right? I mean, regionally it goes on, right? So.
Oh yeah, and this was one of my bizarre experiences when I came here because obviously I've worked in public health across in various parts of England for over 30 years, and there are some things that you just kind of take for granted. You expect particular things to be being done by departments of public health, and you expect them to be able to draw on specific routine sources of intelligence and information. So for a long time after I first came, I was trying in my little brain to think, well, actually these things have to be here because this is just standard public health. I must just be missing them. But no, they weren't.
Because obviously we have high death rates from heart disease or brain tumours or anything. You need to find that information out,
yes, and when I came there was no way of knowing that.
How long will it take you to get a full? I mean, obviously the longer the better.
We're getting there, and we now have, and it's all published publicly on the internet. We do an annual Director of Public Health report. So the first one I was able to do, and it took until 2017 to get even enough data to do a first overview. And that overview was able to look at, by then, some basic indicators from mortality statistics, because we'd managed to get them by then. And also we'd done a lifestyle survey, so we were able to look at things like how much do people smoke, what do our cancer rates look like.
Well, what's the headline then? What's spiking, for instance?
The headline is, we look pretty much just like England. Okay.
What, the whole of England or the northwest? Or?
Well, that's interesting, isn't it? Because England, you can get lots of cuts.
And you get little spikes, don't you? Little areas.
Yeah, you get England average, and then you can get by local authority area, and you can actually often get down to what's known as sort of an electoral ward level. Now, we didn't have any of that here, so what we now have is the ability to compare the indicators that we've currently worked up against the England average, and then see if we can find who do we look like. And there's kind of two ways to look at this. For a long time, and this was the case across, there was a vogue to try and find who your socio-demographic twins might be. And that can be quite useful.
Is that loaded like with population age, for instance?
Age and socio-economic structures.
Have we got a little place in the UK that is just like the Isle of Man?
No, we don't. And that, in fact, is exactly the issue. Because I think there had been some work before I came that had really sort of taken that as the way to go. And in fact, a university across had been tasked and commissioned to try and find us a twin that we could compare with, and the best they could come up with was Copeland. Yes, exactly, which doesn't cut it really, does it? No. I mean, I know Copeland well because as a junior doctor I worked in Whitehaven, and quite clearly the issues there about post-industrial issues, deprivation, etc., absence of a finance industry. I don't think they've got a finance industry in Copeland, or a gaming industry, for example.
We've got this elderly population, and there's worries about that, which must make your data really skew quite a bit, I would have thought.
No, it doesn't skew. Raw data, it obviously would skew, but obviously that's a risk everywhere.
You balance it out?
You balance it out. Right. You do what they call standardised methods.
Right. So give me some good news. It's something that we're really good at here.
Our smoking rates are actually a little bit lower than across.
That's interesting.
Which is good.
Drinking, how about that's higher, is it?
No, drinking is not higher.
Now, it's interesting. Everyone assumes we have a high drinking thing here.
Yeah, but actually the data doesn't bear that out.
How many more years do you really need before you've got some really definitive good data?
Anything that we look at in the Isle of Man, we don't want to look at really on a year-on-year basis. And the reason for that is we've got small numbers, so the number of events for any particular thing are going to be small, and small numbers change apparently massively year-on-year just by chance. Mm-hmm. So we really need to have minimum of 3-year and preferably 5-year data sets.
You get that.
For mortality we have. For some of the other things that we've only just started
and just to finish with, there's no particular one cancer that's showing up here. There's nothing like that. Because people hear, this is the general stuff you hear. That for whatever reason, the Isle of Man's got X or Y, and it's not the case.
We don't. Firstly, when people tell you that, like I've been told we have a much higher rate of brain cancer here, there are no standard data sets to even ask that question. So often you'll find that when people have a worry like this, it's purely anecdotal. Maybe somebody working in healthcare will have said, I seem to see a lot of patients with that at the minute.
Well, I'm the worried well, so shall I take my little bit of aspirin each day or not? So there you go. Can you recommend or not? I mean, but some doctors say don't bother, some say a little bit of aspirin might be good. Should the worried well be worried?
Should the worried well be worried? I think the worried well, by and large, need to think about some of the lifestyle stuff first.
Units of alcohol,
Mediterranean diet, knock the smoking on the head, get out and exercise. And you don't need to join a gym, just go and walk in our beautiful countryside.